Hey guys, this is Dr. Herb. Today we'll look at the indications and the contraindications for the induction of labor. So going by the indications. Under indications, what do we have? There is uncontrolled maternal diabetes mellitus. So there is uncontrolled maternal diabetes mellitus. Next is there is the gestational hypertension. There's gestational hypertension. Then the preeclampsia, as well as the postpartum pregnancy. Then there is also the abruptio placenta. Abruptio placenta. Then comes the premature rupture of membranes. There is premature rupture of membranes. We are writing it as ROM. Then there is also the RH iso immunization. So RH iso immunization. Now the others include the IUGR. IUGR stands for the intrauterine growth restriction. Intrauterine growth restriction. And the IUD standing for the intrauterine death. Next, there is also the oligohydramnios. So there is oligohydramnios. So this is all about the indications of labor. Now let's look at the contraindications. So the contraindications. So under contraindications, it is contracted, distorted pelvis and the cephalopelvic disproportion. So in terms of the contracted or the distorted pelvis, contracted or the distorted pelvis and the cephalopelvic disproportion. The cephalopelvic disproportion. Then let's look at, there is the placental previa as well. So in placenta previa, it is contraindicated, and also in terms of the vasa previa. Vasa previa. Next is the active genital herpes. So it is contraindicated in terms of the active genital herpes. Then comes the pelvic tumor. So it's contraindicated even in terms of the pelvic tumor as well as the carcinoma cervix. Next is the presence of the transverse lie or the footling breach. There is presence of the transverse lie or the footling breach. Footling breach. Then in terms of the appreciable macrosomia, in terms of the macrosomia, and in terms of the severe hydrocephalus, it is all contraindicated. Next is in terms of the umbilical cord, you see prolapse, the umbilical cord prolapse, and also in terms of the high risk pregnancy with the fetal compromise. So in terms of the high risk pregnancy. So the high risk pregnancy is in terms of the fetal compromise. Fetal compromise. Then comes the previous classical cesarean or the hysterectomy. So in terms of the previous classical cesarean or the hysterectomy. Then even in terms of the previous history of uterine rupture. The previous history of the uterine ruptures. Next, in terms of the pelvis surgeries, So what do you mean by the pelvic surgeries? That is like the vesico-vaginal fistula, like the vesico-vaginal fistula or the rectovaginal fistula. The rectovaginal fistula. The pelvic floor repair. Pelvic floor repair. That is, it includes the 3rd or the 4th degree perineal tears repair. The 3rd or the 4th degree perineal tear repair. Lastly, what is the other contraindication? The contraindication, it includes the previous 3 or more lower transverse cesarean sections. So there is previous 3 or the lower transverse cesarean section.